Hi, I'm Gregory Zarian along with Suzanne Watley, and this is HEALTHline. Now, I have a question. What is the largest organ of the body? Suzanne?
It is the skin.
And Suzanne turned French since I saw her last. The largest organ on our body is the skin.
That's right. Well, you know what they say. Beauty is only skin deep.
For some.
You can't judge a book by its cover.
Okay, now you're insulting me.
What handsome is as handsome does. Thank you, Mama Gump.
Thank you, ma'am.
And of course, you know, these are all phrases that are designed to, I think, make us feel a little less insecure about our flaws. And for most people, the external flaws, the flaws of the skin, the acne, the wrinkles, the age spots,
the droopings, for a lot of people, freckles.
Oh,
a lot of people hide behind. They hate their freckles.
Mm-hmm. Well, these are flaws that are indeed skin deep, but we judge ourselves and others judge us based on the appearance of our skin so frequently. And there are also, of course, diseases of the skin. Think about the woman who wears long sleeves in the heat of summer because she's self-conscious about her psoriasis, or the man who can't indulge his passion for golf except at sunrise and sunset because, you know, he's got to worry about skin cancer. Maybe he's already had to lop off the top of his ear because of it. So,
and also kids with eczema.
Mm-hmm. And let's not forget the bane of teenage years, acne. So we're going to be talking about all of these topics tonight with our guest, Dr. Don Mehrabi. He's a dermatologist with a practice in Glendale as well as in Tarzana and an office, of course, in Beverly Hills. Welcome, Dr. Mehrabi. Thank you so much for being here.
Thank you for having me.
And your practice encompasses medical and cosmetic dermatology.
That's correct. We do medical, all medical dermatology, cosmetic dermatology, laser dermatology, and of course surgical dermatology.
Did you know Dr. Mehrabi was my skin doctor? I've been in his hands, and he is an exceptional doctor.
Thank you.
You don't need to know what we did, but you know what? Beauty is only skin deep.
Thank you very much.
Dr. Mehrabi, what got you involved in the practice of the skin?
Well, it's actually an interesting story. You know, I was in medical school, and when you're a third-year medical student, you have to decide what your career is going to be, and then apply for that residency. When I was a first year and second year, and even almost all the way through my third year of med school, I thought I wanted to be an orthopedic surgeon. But you know what? My mom actually said, you know what, take a look into dermatology. And I hate to say that I followed whatever my mom did, but I actually did take a look into dermatology in the beginning of my fourth year. And it was medicine, it was surgery, it was pathology, all in one specialty, and I love being in the office, so it was a perfect fit for me.
But was there also something, since your mother said, please get involved in the study of dermatology, that there was also a vanity behind it too, that, you know, you get to enhance people's looks, you get to, as Suzanne was saying, you know, if someone is covered with acne, they come into your office, you get to actually find a solution as to get rid of it and find reasons why they have it and stuff like that.
Well, that's actually a very good point. Two issues on that. One, when I decided to go into dermatology, it was around the year 2000, and that's before the Botoxes and the Juvederms and all the cosmetic treatments that we have today. So the primary way that we made people feel better was taking care of their acne or making their psoriasis go away or doing other things that were medically related that made them look and feel better. And dermatology patients, I mean, when you do that for them, they feel like $1 million. So, yeah, there is a big satisfaction in that field. And, yeah,
well,
we did think about that.
You're kind of giving people their life back.
Absolutely. In many cases, yes.
Dr. Mehrabi, I looked at you very close up, and you look like you've never had a pimple in your life.
Oh.
Did you suffer with acne as a kid?
I actually did. I actually used to get those, I hate to say it, but I actually used to get those big red ones that you can remember in high school, like on your nose or on your forehead, and you'd be ashamed to walk around for like maybe a week. But yes, you get that. I got that through my teenage years, but as I tell a lot of acne patients, you actually will grow out of it on your own, even if you don't do anything.
So that's left you with a big dose of empathy for
Absolutely.
Sufferers.
Absolutely. I went through it, so I know, a lot about it.
More with Dr. Mehrabi when we come back, and it's all about skin. Don't go away.
Welcome back to HEALTHline. This is a program that you can see every Tuesday night at 7 o'clock on Charter Channel 280. You can also catch us anytime 24/7 online at glendaleadventist.com/healthline or on the web also at YouTube. We have our very own YouTube channel. It's GAMC HEALTHline, all one word, and you can see segments that we have done on a variety of topics from stroke to heart disease, diabetes, addiction, treatment. The list, I would say, is endless, but if it were, then we wouldn't have further programs to do here to entertain and inform you on HEALTHline. Dr. Don Mehrabi, a dermatologist with a practice in Glendale as well as one in Tarzana and in Beverly Hills, has joined us. And we were talking about skin, which is your specialty, of course, dermatology being the study of the practice of medicine pertaining to the skin being our largest organ. What does it consist of?
Well, the skin has primarily two layers, the epidermis and dermis. The epidermis is the top layer, the dermis is the second layer. The epidermis is what you see when you look down at your skin. It's composed of its own 5 layers, and its main function is to protect you from water loss, also to protect you from irritants. It also has an immunological function to protect you against allergens. The second layer contains the blood vessels, the nerves, and this layer is where a lot of the inflammation takes place and then transfers itself to the epidermis. And then below these 2 layers is a fat layer. So the skin is primarily composed of 3 layers, but the top 2 layers is where most of the action is most of the time.
And you mentioned the functions of the skin. Preventing infection is very important. I know that when people get burned, one of the real dangers, because they've lost or damaged their skin, is infection. Do you handle cases of burns?
Yes, of course. The burns that we usually see are first-degree and second-degree burns. And a lot of your common first-degree burns are sunburns. A lot of people come in with that. And also burns from curling irons, touching the stove, touching any other hot object. Those tend to be first-degree burns. Then if you have any kind of blistering, that tends to be a second-degree burn. And now if you get into a third-degree burn, those burns, people always think that they have a third-degree burn and they toss that name around. A third-degree burn is a very deep burn where you actually lose sensation. So if you have a third-degree burn, generally they're not in the dermatology office. They're actually in the ER, or they're with a plastic surgeon getting grafted or having further work done to have their nerves repaired and so forth.
Mm-hmm. And how does the skin interact or work with other organs of the body?
Well, as we mentioned before, the skin protects you against environmental allergens, okay? And one of the biggest functions of the skin is the immunological function. So it works with your immune system. Again, with allergens, so if you get into contact with something foreign, your immune system will come into effect. And that's where a lot of people get poison ivy reactions and so forth, and also have reactions to detergents and such. That's your immune system interacting with your skin. The skin primarily functions on its own, I would say, but there are a lot of conditions where the skin is an external marker of internal disease. So a lot of internal cancers can present with skin findings. So that makes the skin a window to everything inside the body. For instance, certain pulmonary cancers or gastric cancers will present with certain findings on the skin that you might see. Diabetes also has skin findings. In relation to specifically other organs, the skin can also have effects on the heart. So someone with psoriasis who's completely red all over draws a lot of blood away from the heart, and they can actually go into heart failure. So as innocent as the skin looks, it can be a window to what's going on inside the body and can also have effects on other organs inside the body.